Hi friends, happy Monday morning. I am back again to hopefully answer more questions for you. To get started, I'm not going to waste any time because I'm working on making these videos a little bit shorter for you. I just want to give you a quick rundown on the numbers. I won't spend too much time on this because I know they are readily available to all of you. Unfortunately, we are up to 367,000 cases in the world. 42,000 of those cases are in the US, 1,500 almost in California, and there is a tenfold higher incidence in New York. We now have 11 documented cases here in Kern County as of this morning. So not surprisingly, our numbers continue to rise, and I believe that they will do so probably for at least another 1 to 2 weeks, if not more. For those of you who are still not social distancing, honestly, I don't have any more words for those people. When the head of the NIH, the Surgeon General, all scientists, doctors, your parents are telling you what is best, and you're still not listening, then I don't think my words are going to be the ones that convince you. Go ahead and listen to the beginning of my last video if you want to know how I feel about your actions right now. But honestly, at this point, I just adhere to the philosophy that you can't argue with stupid. Thank you for those of you who feel differently than me and you continue to educate your networks and tell people how important it is to socially distance, because quite honestly, that is our one fighting chance right now. So many of you have asked, how long is this going to last? And honestly, we don't know. As I mentioned in my previous video, it took approximately 3 months for China to go from having their very first case to having a countrywide pandemic to having no new cases in a 24-hour period. And that happened after a major military lockdown was enforced. Not a strong recommendation by their president or their governor, or I hope you do this for the greater good, but literally you cannot leave your house without incurring jail time or a fine. And we are not there yet. I don't know if we will get to that point, but that is ultimately what allowed the numbers to improve in China. I do know that the longer that people don't socially distance, the longer this keeps going, because we're going to continue to spread it, and those of us who are practicing social distancing will continue to do so, but it seems a bit unfair that we are doing our part and those few rotten apples out there are going to have to make us do it longer and longer, but unfortunately that is the fact of the matter right now. It also takes about 2 weeks to see the effects of what we are doing when it comes to the numbers and the graphs and the charts that everybody is looking for. So everybody in the US started socially distancing at a different time, right? Some of us, maybe it was 2 weeks ago. Some of us, maybe it was a week ago. Some of us, maybe it was just last Thursday after the governor of California made his recommendations. But in order for us to start to even get a glimmer of hope, it will be 2 weeks after change has been implemented. And again, we're not all on the same page yet, so I don't even know if we're going to start to see changes of our actions within 2 weeks. I'm sorry, I know that sounds kind of dismal, but I think it is what it is right now, and it's important for people to sort of understand where we're at. I have had a lot of questions about what people can and can't do. And I think probably one of the best recommendations that I heard today was when the Surgeon General spoke, and he said, act as though you have it. Simple as that. Act as though you have it, and your behaviors thereafter should be based on how you want to spread this to those of the people in your world that you love. So I know it's hard. I have found myself faltering because sometimes I want to do a little more than what I am doing. I would love to go and get takeout even when I already have food in my fridge. I would love to just get out there and do something more. I'd love to go spend more time with my parents. But then if I ask myself, okay, if I had this virus in my system right now, would I do any of those? Absolutely not. I would sit at home being bored by myself, protecting those around me. So I think that may help you in terms of gauging it. And I know it's a very strict guideline, but I think with the way that our numbers are trending, things are going to have to get more strict. A lot of people have asked me, can you get it again? And honestly, we don't know. There have been case reports in Japan and China for individuals who tested positive and then recovered, but then they tested positive again. And what we don't know is the second positive test just a reflection of the first infection and they never fully cleared the virus from their system? Or did they in fact completely get better and then have a positive test again because of reinfection? And we really just don't know what's going to happen in regards to that. So again, the best thing is to exhibit great caution, and hopefully as we learn more and more about cases here at home, we will figure out whether or not one exposure and one infection will give you lifelong immunity. A lot of people want to know, okay, so when do I go to my doctor or when do I go to the emergency room? First and foremost on my mind, of course, is our kids. So it's important to talk to your child's pediatrician about this. As of right now, my office is still doing well visits in the morning after our cleaning crew has scoured the place as much as they can. We're bringing in those well visits that need to be seen, namely to provide them with their vaccinations, because despite what is happening in our world with this virus, we certainly cannot forget about all the other viruses and bacteria that we need to protect our babies and kids from. So we are continuing with that. I don't know what the case will be even next week or the week after that, but I do think that if your child is due for immunizations, it's important to talk with your doctor about how and when they can get those shots. In regards to other routine appointments for yourself or for your kids, if you are feeling well, then postpone them. That's kind of the bottom line. If you need refills on your medications that you typically would get by going to your doctor's office, I would call them. I know a lot of doctors are now setting up telehealth visits so they can sort of talk to you the same way I am through a camera screen, make sure that you're doing well and put in the prescriptions for you so that you can continue to stay on your medications and stay healthy. If you have a cold, please do not go to our emergency rooms. Please do not go to your doctor's offices. I know that you are worried that you might have this virus. I am telling you, I had a tickle in my throat and a cough yesterday, and that was the first thing that popped up in my mind. My son was running a little rundown last week. That was the first thing that popped up in my mind. But we cannot have you guys out and about to provide you with reassurance at a time like this. I really wish we could, but it's not safe for you and it's not safe for us. So we don't want you to come in just because of what's going on right now. We want you to come in when you are genuinely sick and you feel as though you are now beyond the capacity to care for yourself at home. This goes for the same thing with allergies and sore throats, low-grade fevers, body aches, loss of appetite, a little bit of vomiting and diarrhea where you're not dehydrated. I am by no means saying that perhaps you don't have coronavirus. I'm just saying that we don't necessarily have enough tests right now, and we are not going to do much for you at home other than to tell you to rest and take fluids and take care of yourself to the best of your ability, and then to call us back if you are getting to the point where that's not good enough. Many of you have asked about new reports of babies and children being affected. And I will tell you, this virus can affect babies and children. We know that. We have seen that. China has shown that. Italy has shown that. We have babies and children in hospitals right now with the virus. Fortunately, it is just at a dramatically lower rate than those who are over the age of, I would say, 60. So it doesn't mean that we need to be nonchalant with our kids, even when they have a cold. I definitely want you to monitor them very closely. It means that we shouldn't be having play dates because, again, as I mentioned, I think in my first video, our children may very well be the vectors because they're not going to feel too bad, most of them, but they definitely will have the ability to spread this to you or to their grandparents or to their neighbors. Going back into symptoms a little bit, so it's becoming very apparent as we are starting to hear about more and more cases throughout the US that many are going to have a mild case. And this may be cold symptoms or a flu-like illness with, as I mentioned, low-grade fevers, body aches, fatigue, loss of appetite, sore throat, and cough. Whether or not you have these symptoms, I can't tell you for sure whether it's coronavirus or it's allergies or it's another virus, including influenza, that is here. But there isn't a whole lot that we can do for you, just like we can't with the common cold. And so if your symptoms are relatively mild, even though you are scared, again, you've got to be able to stay home. It's when you get to the point where you're like, okay, this is not just past my comfort zone, but I'm actually starting to get scared that I cannot breathe well. I can't take in a deep breath and I can't exhale like I normally do. I am so dehydrated that I haven't gone pee in a very long time, let's say 8 to 10 hours at least, and you're not able to keep liquids down. Or perhaps it's that you're just so lethargic or even slightly disoriented. It's those extremes when it's time to seek medical care. Remember, when you're feeling down, but not scary down, that most of us who will get this virus will never be tested and will never have a severe illness. I know the numbers are scary and that when you start to feel bad, the first thing you want to do is seek reassurance. But this is why I'm doing these videos, so that I can be your reassurance that, again, most of us will never even know if we had this virus, and most of us will recover. Some are going to have a much more serious case, and we need to do our part not to spread the illness within us to those who could be at risk for more serious disease. And so on to testing. I wanted to talk a little bit about this because everybody is asking, well, why can't you just test me so I know? We don't have a good enough test right now, and we don't have enough of it. So there are a lot of offices and clinics that do what's called BioFire, and I know we have this here in Kern County. This is a nasal swab, and it checks you for 22 very common respiratory pathogens, both viruses as well as bacteria. And thus far, from the studies that we have seen out of China, if you test positive for one of these other respiratory viruses or bacteria, there is a less than 2% chance that you also have coronavirus. So the nice thing about BioFire, if your office is able to test you for that, is that if you test positive for something else, it can make you breathe a little bit easier that perhaps you don't have coronavirus. Now, if someone has the BioFire testing, which the results are usually available within about an hour, and that's negative, and there is a very strong suspicion that that person could have coronavirus, either based on their exposure or their illness, that's when we will send out for the coronavirus. And here in Kern County, we are sending those tests out of town, and the turnaround time is anywhere from 5 to 10 days. So the reason that I share this information with you is that a lot of us have to act without the knowledge of, do we have it for sure or not? As I mentioned earlier, if you are worried and you think that you might have it, let your actions reflect that. People have been talking about home tests and what's wrong with these labs and why can't they get the test out. And I just want you to realize that coming out with any old test is not a good thing. Laboratory tests are never 100%. They always have a certain degree of uncertainties, specifically a certain amount of false positives and false negatives. A perfect test would have a 0% chance of this, but I don't think that any test exists like that. And you can imagine if all of a sudden we all got coronavirus testing kits in the mail and it had a high false positive rate, the type of fear that that would invoke. And as much as I'm telling you to stay home, I think a lot of people would get that positive result and go straight to their local emergency room. And then imagine how many people would be exposed to that, whether they had it or not. What if it's a false negative? You say, oh, thank goodness, I'm fine. And then you go out and talk with your neighbor, or you go and visit your parents, or you go to a local restaurant to support them and you get your takeout, but you really did have it. So we need a good test, not just a test, before we can really start to base our actions on that. And in the meantime, we have to do what we can in the without it. Masks. Masks are another big topic that everybody is talking about. I'm sure you've heard that there has been a huge shortage of masks and other protective equipment for healthcare workers. And the mask that will absolutely best protect you is the N95. And apparently people stockpiled these, hoarded them, stole them, and there are not enough left for healthcare workers. So in response to that, there has been a lot of interesting responses. The CDC has said, well, do what you can and wear a scarf or wear a bandana. And quite honestly, as a healthcare provider, that is frightening. Absolutely frightening that is what we are resorting to in this first world country, that we're wearing a scarf to protect us from a virus that could potentially kill us, only because we once had the protective equipment that we needed and it's been stolen from us. So I want to say thank you to those of you who have gone out of your way to create relief efforts for us. I know people are asking estheticians, tattoo artists, anybody who has masks to donate them, any type of mask. A lot of you are now starting to sew masks, and your efforts do not go unnoticed. I really appreciate that. Granted, they are not the N95, they don't provide that protective seal, but honestly, at this point, we are all working with what we have, and so I appreciate you for that. For those of you who are not healthcare workers and are wondering, do I need to wear a mask when I go out in public? The general recommendation at this point in time is no, because quite honestly, if you don't have the mask that provides a very tight seal over your nose and your mouth, it's not doing very much good. And the only time you should really be wearing a mask if you are not a healthcare worker is if you are potentially infected or you think you are infected and you are leaving your house. And I hope that if that is the case, you are leaving your house to seek medical care, because you are then a risk to other people. We have a lot of immunocompromised in our community, and they are used to wearing masks. And if your doctor tells you to continue to abide by those precautions, then absolutely listen to your doctor. A few more topics, and then I will wrap up. A lot of you wanted to know what is happening with treatment out there. And I will tell you that there is some good news, but it is so preliminary that it should not affect our behavior at this point in time. And every person who is being treated is really doing so on a case-by-case basis. And of course, if you're getting your treatment information from like techstartup.com, please interpret it with a grain of salt and don't tell everyone that they have a great new medication out there, but the doctors aren't giving it to everybody who can have it, because techstartup.com is a little bit different than the New England Journal of Medicine. So what is probably getting the most attention right now is a combination of two oral medications. The first one is called hydroxychloroquine, and the other one is azithromycin, or your standard Z-Pak. When hydroxychloroquine is a medication that has been around for decades, and the good news is that it is available in oral form and it is cheap. It has been used for both the prevention and treatment of malaria, as well as for various autoimmune conditions like lupus. Azithromycin is available as a Z-Pak, and that's what a lot of you have probably taken in your life for sinus infections, pneumonias, bronchitis, etc. And it turns out in the very small number of cases that this has been done, that if you combine the two, it can help to drop the amount of virus that is in that person's body very quickly and very dramatically. But the most important thing to know is that this combination of medications can be dangerous. It can actually induce a life-threatening arrhythmia. And an arrhythmia is an irregular heartbeat. So I don't want anybody, even if you have access to these medications, to be putting them together and taking them because you think you have it and you're really at a point where you think it's a last-ditch effort and I've got to do it. Because quite honestly, if your heart rate goes berserk and you end up in the emergency room for that, you haven't done yourself a service. Please wait until we know more about this combination of medications. At this point in time, it is going to be given to those who are the sickest of the sick, where they are literally getting to the point where we don't have very much to offer them, and their heart is connected to monitors so we can see if that arrhythmia develops and we can treat it immediately. This is not for you and me by any means at this point in time, but as we continue to give it to more and more and more very sick patients, we will start to learn if it is an option for those who are less sick, and most importantly, if it is safe. The other medication that has been under investigation is an intravenous medication, and it's called remdesivir. This has been studied with other serious viruses in the past, including Ebola, as well as SARS and MERS. Right now, it is being thoroughly studied in 5 very large studies. And again, the only way that someone can get this is through an IV when you are amongst the sickest of the sick and you are enrolled in these trials. The pharmaceutical company that created remdesivir was providing this medication on a compassionate use basis as well, but they are getting basically overrun with requests. They can't even keep up with it. And so at this point, you may only have access to this medication if you are enrolled in the studies. So again, a lot of unknowns, and stay tuned, but this is what information we have thus far. Last but not least is the vaccine. So while I can't say for sure, again, I'm sorry for all these unknowns, Dr. Fauci, who is the head of the National Institute of Allergy and Infectious Disease, said that it could probably take 12 to 18 months before we have a reliable vaccine. And again, this is for the safety of our community. If we rush to put out a vaccine that doesn't work, that's not going to help anybody other than maybe the one day that it comes out and everybody celebrates and feels good that we have a vaccine, only to find out it's not working. The other thing that's important with these vaccines is to make sure that it does not cause harm when it is administered or when you become infected with the virus. Many of you may know what RSV is, or respiratory syncytial virus. This is a virus that causes common cold-like symptoms in older children and adults, but in our very young babies, our preemies, our babies who have heart disease and lung disease, this can be a life-threatening respiratory illness for them. And at one point, they created a vaccine, and what they realized is that if the baby got infected, had been vaccinated, and then got infected with that vaccine, they had a more aggressive or more violent response to the illness in comparison to those who had not been vaccinated. We certainly don't want to recreate that again. So while we need a vaccine, and while our researchers and scientists are working on a vaccine, this process cannot be rushed because we have to ascertain the safety of those who will ultimately receive the vaccine. And so the bottom line right now, guys, is that the only thing that's going to work for sure with the resources we have is social distancing. But the beauty of that is that you don't need a fancy medical degree to understand that or to do it. You don't need to be the top virologist in the world to do that. You can do it, and I can do it, and we actually can stop this virus more quickly than medications and vaccines can, given that it's going to be months before we know for sure what these medications and vaccines are going to do for us. So, on a side note, this is obviously a very tumultuous time for so many. And for those of you who have family and friends that are in the hospital fighting for your lives, please know that my heart goes out to you. For those of you who have lost your jobs and you're struggling to make ends meet, I'm thinking of you too. And of course, for every single one of you who are in a service industry of any sort, I want to thank you for working tirelessly to keep us healthy, to keep us fed, and to keep us safe. But honestly, for the rest of us, maybe this is a little bit of a wake-up call to slow down. I don't know why this is happening, and I really wish it wasn't happening, but at some point we have to ask ourselves, is there something to be learned or to be gained from this experience? And I think perhaps it's for many of us to get out of the rat race, to slow things down, and to appreciate what is around us. I will say that in this time, I have played Monopoly with my kids. I've gone on more walks than I can count with them. We have dinner together. We watch The Karate Kid together. I come home from work tired, but then our evenings are slow and we actually sit together. I sleep more and I look at my family more. Like I literally just look at them and I stare at them, and my mind isn't constantly buzzing about what time it is and who needs to get where, when, and how. But I just look at them and I just appreciate them and that they are in my life at this very moment in time. So, for those of you who are looking for solace in such a difficult time, realize that there is something to be learned from this experience. Take this time of social distancing to appreciate what you have and to just look around and love on your family and your friends. All right, guys, that's it. I hope it was helpful, and I will see you next time. Take care.